Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where I bring you key experts in the fields of nutrition, prevention, integrative and lifestyle medicine, or I'll talk about a particular topic on my own. And today is actually kind of a combination because I'm going to review an interview of Dr. Mary Talley Bowden, ENT specialist, with four different experienced clinicians in treating vaccine injury or post-vaccine syndrome. And that is Dr. Peter McCullough, MD, cardiologist, Dr. Pierre Kory, critical care specialist, pulmonologist. That's Dr. Stewart Tankersley, MD, and then also a well-known functional medicine doctor, Dr. Molly James. And what I'm going to do is I took the transcript of the interview and I ran it through AI and asked it to give me a summary and then also an outline because there was so much information from each physician. I didn't know how to, it would have taken me forever to do it efficiently and as thoroughly. And then I went through and edited it to make sure things were what I heard. And then I added my own experiences at the bottom. So there's actually six clinicians that you can choose from. Now, one of the things that you may wonder about is when you go through this, you're going to hear some physicians say what the other clinician didn't work for them. And you can say, well, that doesn't make any sense. Well, here's the way medicine works. And especially when you're doing a variety of different alternative therapies, you get comfortable with two, three, four therapies or five therapies, and you have a certain outcome that's usually is positive. That doesn't mean a cure, it just means a positive. The patients are happy and you are happy in the direction they're going. If someone listens to somebody else's talk but doesn't do the therapy as deeply and cleanly or thoroughly as the other practitioner, they may not get the same result. And we all have our biases, but I think that's what you're going to hear. And so I kind of wanted to summarize it with my own. So at the bottom, there's an outline of each of the clinicians, what they said and proposed. And then I summarize what I do. And then what I want the audience to be able to do is number one, go through this extensive amount of data quickly because I know everybody's busy. So I want to keep these videos under 30 minutes. But this one's going to be a hard one. I'm going to try and do that. But I want to also have it written so you can go back and check it out. And there's links to these physicians' websites and some of the links to the therapies and products that they encourage. And then I have my normal links to things like cancer treatments and nutrition, things that I would like to go over, but I don't know if I'm going to have enough time. So, number one is before I get into the interviews and the summary of them, there were some big things that happened. And one is Dr. McCullough did a nice summary of, where did the COVID virus come from? And, it's a man made virus. And it was probably made initially in Chapel Hill, the Ralph Baric labs, and then it was uh, enhanced in Wuhan, and then whether accidentally or intentionally released, we don't know. So number one thing that I get, and I have to listen to it over and over and over again from somebody who's really articulate on the science, is that the four coronaviruses we had before didn't cause an pneumonias and destruction, even though they had a spike protein, as the COVID virus that was man-made that came out of Wuhan. That spike protein caused serious damage, clotting, and it was lethal. Now, the next part is what came from the vaccine, the man-made vaccine, the messenger RNA, created a spike protein that we hopefully made antibodies to that was even more lethal and less. There's less ability to destroy it by our own bodies than the spike protein that was made in the man-made virus. So it's even worse. Plus, I always tell patients it's kind of like a Trojan horse. It was delivered in lipid nanoparticles, so it got into our tissues, into our cells much more efficiently. And we don't know how long this one's going to last. So that's one thing that I want you to get from the initial part of this that I have links to. Number two is that there is an attempt being made, though we'd all love to see our childhood vaccination schedule, I think, dramatically changed and not be mandatory. But there was a movement to move it towards more of the depth and the frequency of the Denmark version. So there is some movement in cutting back on vaccines to I think it was like 55, which is still an astronomical amount. When I think about when I was in 1957 born, there was a total of like 18 vaccinations, not even that much. So anyway, those are links up there. Now let's get into the meat of the show, which is vaccine injury and what are these 5 other physicians. And I'm going to say, even though Dr. Mary Talley Bowden, and she's an ENT specialist from Houston, Texas, been very outspoken in treating COVID and early COVID and vaccine injury. She was the interviewer of each one of these people, but she had her own, not biases, but her own approaches. And she starts off with hers, and then she's asking these other clinicians, like we all should do, is that we ask people we trust who are trying to be honest, who've come up with ideas, they have experiences using these modalities, and then we try them, and sometimes they work, sometimes they don't, but sometimes we don't do them as effectively as the person who is talking about it. So Mary Talley Bowden start off with herself, and one of the things she starts off with is ivermectin. So ivermectin is a big part of her initial protocol, but she feels like she gets stuck with severe neurologic illness patients with vaccine injuries. So the first person she interviewed was Dr. Peter McCullough, who I'm most familiar with because I've listened to probably every single one of his McCullough reports 2 or 3 times. And so he's, a big spike protein, I want to say anti-spike protein, but he believes that the spike protein is the problem in COVID injury. And so his approach is he came up with the ultimate spike detox, which is a combination of curcumin, bromelain, but high dose nattokinase and a few other herbal products. And he encourages very much the doing of the spike protein antibodies, the IgG qualitative from LabCorp, and getting a score there. And the goal is to get it below 1,000, according to him, and treated aggressively with the spike protein detox components at a high dose on an empty stomach. So that's one of the things that he encourages. And then the other things are he encourages N-acetylcysteine. He doesn't have any problem with that, using that. They're using the augmented form. I'll have my own comments on that. He also, when you have SARS-CoV-like symptoms or fevers or things of that flu-like nature, then he would add high-dose ivermectin for 90 days. If it's more of an autoimmune issue, ANA titers elevated, and joint pain, neuromuscular, he might use hydroxychloroquine, 200 milligrams twice daily for 90 days. Other approaches that he doesn't feel work. So, where I like low-dose naltrexone, he doesn't feel that helps a lot. So he is probably the most outspoken, but the goal there is to reduce the spike protein antibodies down to less than 1,000, and usually that might take 9 to 12 months. And he encourages the use of the components in the ultimate spike detox. Of the base ones are really high dose nattokinase, curcumin, and bromelain. Next was Dr. Pierre Kory, Critical Care Specialist. We know him from writing the War on Ivermectin. I think he's also writing a book now called The War on Chlorine Dioxide. But he sees a lot of vaccine injured patients, and he separates this syndrome into 2 things. One is post-COVID vaccine syndrome, which is something like chronic fatigue, myalgic encephalomyelitis. Symptoms are, profound fatigue, exertional malaise, cognitive dysfunction, separate from acute vaccine injury, which might mean myocarditis, stroke, Guillain-Barré syndrome. But his first-line therapies is ivermectin. So he uses that quite a bit. He says there's a 70% response. Some is dramatic, some is more moderate. He likes to use low-dose naltrexone, which you're going to hear, which Dr. McCullough didn't feel was as beneficial. He uses low-dose naltrexone early and titrates it up slowly, and he'll use it for immune modulation and for anti-inflammatory effects. And then he gets into mast cell-directed therapies, which include dietary changes to reduce triggers, and then H1 and H2 antihistamines and mast cell stabilizers. and some people have dramatic improvement from that. Then he talks about a triple therapy and anticoagulant approach. The spike protein is noted for causing increased clotting, and he uses a triple therapy of direct oral anticoagulant like Eliquis, and then antiplatelet therapy, aspirin therapy, and he tends to add nattokinase. Not so much that he sees a dramatic improvement with it, but it makes biochemical sense. And he's also been using I've never heard of this, sulodexide. It's an anticoagulant from Russia and Japan. So he's also done things like he'll send people to clinics, clinics that will do things like apheresis, ozone therapy, hyperbaric oxygen, IV vitamin C, methylene blue treatment, near far infrared light, for several weeks, and the people will come back. The problem is that while they come back improved, it costs a lot of money and it doesn't seem to hold. So that's a little frustrating. He's a big fan of chlorine dioxide. He's writing a book on it, so I'll leave that for a later date because I'm not sure how much he says he's used it in this regard. He's into ketamine right now, low dose ketamine, either orally or sublingually, and he's doing some training in this with people who are very experienced, and he's very upbeat about the use of ketamine. Then he uses DMSO and NAC. More NAC, and his colleagues, his medical colleagues, use the augmented form, and that's one of the favorites for dealing with vaccine injury. And he uses DMSO topically and orally for joint swelling and arthritic symptoms. So the next person is Dr. Stewart Tankersley, MD. He's a family practice doctor doing integrative therapies, practicing in Alabama, and he feels that anybody who's got a vaccine needs to worry whether they're having symptoms or not. He has an extensive checklist, and he encourages people to undergo a detox if they have, even if they don't have symptoms at the moment. So some of his things are, if he has a positive ANA, he does a spike antibody test as a kind of a surrogate for spike protein load. And if it's a positive ANA, he uses LDN and hydroxychloroquine. And then I've never heard of this one. His colleague, Dr. Jordan Vaughn, who's an outstanding physician and an expert on anticoagulation therapy for COVID syndromes, has found out that there's a pelvic syndrome, that there may be some pelvic vein clotting, and they use some treatment for that. His core treatments or regimens starts off with ivermectin. He's a big believer in ivermectin, around 0.3 milligrams, sometimes going up to 0.6 milligram per kilogram. Then he has a product called Centurion B Plus, and I put links to the different practitioners' favorite products. That contains black cumin, sea powder, bromelain, N-acetylcysteine, luteolin, lumbrokinase, and serrapeptase. So we have some enzymes there, and we have some antioxidants and detoxifiers. And then he uses a probiotic, and he likes resveratrol. So he does use low-dose naltrexone. He was a user of methylene blue, but he's a little cautious now because Dr. Peter Breggin came out with a little commentary on possible adverse consequences. But he ends by saying, ivermectin remains the central kind of approach. And he believes he can help people improve. About 90% of patients improve remarkably. The next person is Dr. Molly James. She is a functional integrative medicine physician at the James Clinic, and she highlights 4 basic therapies for vaccine injury or vaccine syndrome, and that is the use of ivermectin, somewhere between 0.2 and 0.4 milligram per kilogram. And noting that, in cancer patients, you might start at a 0.5 milligram per kilogram, but go up to 1.5 milligram per kilogram. And I know something about that because I had cancer, and I've taken, someday we'll talk about that, but I've taken higher doses than probably anybody. But she uses something that I'm very interested in, that's phenylfibrate. It's a non-statin lipid-lowering agent, and she says it binds onto the spike protein, which would be nice to have another simple pharmaceutical that would actually, you could treat and bind onto the spike protein. She uses omega-3 fatty acids as an anti-inflammatory and for endothelial support. And then she has a product called Core Support, which is a mixture of amino acids and anti-inflammatory agents. And I'm sure this helps with vascular inflammation and systemic inflammation and helping the gut heal. So she does cardiac workups. She looks at mitochondrial function. The other thing they do is IV PRP at their clinic, which is a way of spitting off red and white blood cells and reinfusing the concentrated plasma and platelets in an IV, and that can help with healing. I've seen that work. We used to do it in our clinic. We had a physician who was very good at that. The other thing she does is IV glutathione for detoxification. I'm familiar with that. And then they have their clinic is set up so they can do some of these therapies aggressively and long term in the right way. So instead of sending people out, she has extracorporeal blood oxygenation and ozonation. So they take the blood and they run it through a filter that's exposed to oxygen and ozone, and this helps an ultraviolet light, and then that helps kind of clean it out, so to speak. They do that, and they do 3 or 4 weekly sessions. They also do hyperbaric oxygen, which you've got to do a lot of it to get the feel of it. And they will do that, and that helps with neurologic symptoms, brain fogginess, and people with shortness of breath. She uses regular NAC. She's not quite there on the augmented NAC. She's not using actually nattokinase, and she's not doesn't follow really the spike protein antibodies. She's more of just treating the patient without focusing on that. So I hope it's all outlined. I tried my best to link it up and summarize them, but you can go back and read it underneath the Substack here, and then I'll give you my thoughts. So one of the things is that, again, if physicians don't do a therapy a lot and somebody else tries that therapy, even though this person may say it has worked, if they don't do it with the same thoroughness and completeness and expertise, they're not going to get the same results. So sometimes there's only so many therapies you can get good at, okay? And there's some that I just can't do because we just don't do them enough to get good at it. So here's my approach. Number one, whenever I see a complex patient, I don't care whether, if they say it's vaccine injury, I'm still not going to start from just looking at vaccine injury. So my first thing is diet. You've got to be eating an anti-inflammatory diet, not one that is stimulating pro-inflammation. Because if you have a base of inflammation and then you get the vaccine, that's you're going to be more susceptible to having damage. Okay, so you have to reduce the load on the immune system. So very simply, 43 years ago, the first practice I worked in, the physician I worked with put everybody on this vegetable puree for 2 weeks. And basically, they got off everything they were doing, and they were doing a kind of a green drink fast. And I saw every symptom improve. Honestly, I can't think of one that I didn't see. So that's where I knew that food could cause inflammation. Now, I wasn't even thinking about the microbiome then, just that. But so that's always stuck with me. So I try and take everybody off, do something simple that they can all do very quickly. So I say no wheat, no eggs, and no dairy. 100%, no alcohol, no sugar. And if you can get off coffee for 2 to 4 weeks, if you can do those things, we're going to find out. And the rest is whole food. So you just say whole food, that wipes out all the ultra processed foods. Now, people might ask, well, I get kind of wheat, and I kind of get dairy, but what about eggs? Why are you doing that? So everybody's into protein now. So there's many people, I shouldn't say everybody, but many people are eating 2 or 3 eggs a day. And I'm not even talking about the debate about the content in the egg. What I'm talking about is this is a common allergen. And I have seen people devastated that get off eggs and do better. So I'm not saying eggs are bad food, but you want to test them if somebody's eating eggs once a week, that's not the issue. But if they're eating 2 or 3 eggs a day, you might want to check and see if they're sensitive to it. And I've seen it. I mean, I just had an amazing case of somebody who was doing everything right, spending lots of money, and I finally got her to get off eggs. And all of a sudden, her Meniere's type syndrome, where she was just flat out, went away. Very successful business person, went about her way, saw her a year, came back all excited and happy and strong and everything. And I go, did you ever reintroduce eggs? And she goes, yeah, I was on vacation in Hawaii. I reintroduced eggs and same thing happened. So it can be one food. So that's why I include that. So whole foods, some kind of low allergy approach. The second part is I encourage people to do modified fasting. And so we have a clinic. It's called True North, about an hour away from us, hour and a half away from us, excuse me. And they're probably the kings in water fasting, done 25,000 plus water fasts. But it's hard to get people there, and they got to stay there a while. So one of the things, and I have had people have great results there. They're just time and money. But so I'm a big fan of the fasting mimicking diet, the work of Walter Longo. Probably studied the 5 day fasting. Well, he created the 5 day fasting mimicking diet. It puts you in a fasting state, stimulates autophagy, anti-inflammation. It stimulates stem cells, lowers, lipids, A1C, almost does everything. That's simple enough that a busy person can do in 5 days. And so it's very cookie cutter. So I use that a lot in my patients. I'll start them off on the anti-inflammatory diet, and they come back after we get the lab work and go, okay, this is what I'd like to see you do. You've been sick, a long time. Do the 5 day modified fast. Everybody can do it. In fact, I'm on day 2 right now. I do it for keeping the cancer away. Um, but you can do it while you're working, and it's something that everybody can do. So that's one thing I do. Those two things: elimination diet, whole food diet, and then I do periodic fasting. And somebody like this who was vaccine injury, what I tell them to do is do it once a month for 6 to 12 months, because I'm sure it has some effect on detoxifying. Um, as sure as I can be without a study. Okay. So the next thing I do is when I take my medical history, I don't just, again, start from vaccine and work forward. I go back each decade of life. Do they have a history somewhere of lots of antibiotic use, whether when they were a little kid had chronic ear infections, or when they had tetracycline for acne, or whether they had chronic upper respiratory infections and a chronic urinary tract infections, but somewhere where they got a big insult of, I'm not talking about one round of antibiotics. I'm talking about, I have patients that, have had four, oh yeah, every year of my life for the first 10 years, I had 4 or 5 rounds of antibiotics. That is going to alter your gut flora. That is going to cause problems. And that's what you're going to see down the road. So if I see a history like that, even in this kind of patient, I'll give them a 2 week trial of fluconazole or an antifungal. Usually a systemic one, because it usually works quicker, less die-off if it's going to happen. And then I'll see. Sometimes fog improves, sometimes energy improves. Now, again, I'm working under the base. I'm trying to reduce the total load before we get into the specifics of treating the vaccine injury. So I'll do that, use nystatin tablets or nystatin powder, and I'll do it 2 to 4 weeks if warranted. Because I have this, this will be a bad pun, I have this underlying gut feeling that the gut microbiome is the key. And I actually have interviewed Dr. Hazan Sabine. You'll see the link in here, a world-renowned gastroenterologist, a world-renowned for famous work on doing working with COVID. And if you have bifidobacter, COVID virus goes down. If you're low in bifidobacter, COVID is up. And actually, I'm actually doing some of my own uh, program with her on the gut microbiome and prevention of recurrence of colon cancer. So I can attest for her approach. But I think that there's something about the gut microbiome that we want to normalize as best we can if we're going to give these people a chance to heal. Next, and then now here's some more common things that our clinic is good at, and we do a lot of vitamin C. I've done IV vitamin C for 40 years, and I had adult chicken pox at the age of I think it was 26 or 28 when I was at the clinic, and I looked like I had cystic acne from my top of my head to my groin, and I got 80,000 milligrams a day for a week. I was, so we've used a lot of that, and it helps. It's not a cure-all. So I think IV therapy is to help boost people forward, help them get up until they can get back on their feet, because you don't want somebody on IVs forever. Okay. So I usually do it, 1 to 2 months if we can do it. The first month, like twice a week for a month. We use B vitamin injections, but I always add thiamine with the folic acid and the B1. I mean, excuse me, and the B12. I don't do just B12 alone. Thiamine is very, 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 very important for energy metabolism. In fact, it's been used by itself to treat chronic fatigue, and I think it was multiple sclerosis as well at very high dose. So we do home injections, teach people how to give them at home. Then the other IVs that we use would be, uh, let's see, we do NAD at home. That's very effective. We'll give someone 10 shots to do at home every 3 days. We do IV glutathione, alpha lipoic acid, and hydrogen peroxide. So when to do those? Well, you try sometimes. Let's say somebody did 4 IV infusions of vitamin C and it didn't help at all. I might switch. So that's where the trial and error comes in, okay? Because you just have to use your clinical judgment. The next part is all these people are usually adrenally exhausted. That that term in integrative medicine that everybody overuses. But so sometimes I'll use a strong glandular support product that we have, or there's a wonderful book that was probably 30 years ago, Safe Uses of Cortisol by William McJeffries, an endocrinologist from Case Western. And he was a traditional doc who treated chronic fatigue with cortisone acetate or cortisol, 5 milligram 4 times a day. So sometimes when people are over supplemented, I mean, they just can't take another pill, then we'll just use low dose cortisone. And I'll use low dose cortisone. It's cheap. It's about 1/4 to 1/5 the potency of prednisone. You don't suppress the adrenal glands, but you help build them up. So that's the goal. So sometimes I'll use that therapy. Then some of the basic supplements, that everybody uses. I'll do IV vitamin C, 1 to 5 grams. This is orally. Vitamin D, 5,000 to 10,000, keeping the level of vitamin D between 50 and 75. Vitamin K2 would be included in that. CoQ10, I use at big doses. I measure it. I don't care where you get it from, but I'll measure it. And I see it all the time come up. And so 2 to 600 milligrams a day. Magnesium glycinate, I use 2 to 400, and some kind of bifidobacter-rich probiotic and a colostrum product and omega-3 fat. So that's kind of a core. And then specific things would be the ultimate spike detox. I'm taking 8 myself because I have another funny, not a funny story, but I took 2 vaccines. I never take vaccines, but I did two vaccines in 2021. I had colon cancer 2 years later. And I don't necessarily believe it's all the vaccine. I think I lived a lifestyle at that time, very stressful, that wasn't high quality. And my head wasn't right. But I take the spike protein detox. I switched to that. And I had a spike. And something happened after I had my colonoscopy because I was starting to go down. I was in the 6,000s. I went from 7,500 to 6,000. 6,000s. And I was taking then just separate nattokinase, higher dose ivermectin because I was tapering it a year past my colon cancer removal, which was just my tumor removal, which was about a year ago. And so I was on a maintenance program. At least that's what I was believing I was doing. And something happened after my colonoscopy because all of a sudden my spike antibodies spiked. Now I don't feel bad. In fact, this is the best I've felt, but I have the highest spike antibodies that I've ever had. So we're going to see what happens. I'm doing 8 of the ultimate spike detox. Dr. Sabine wanted me to cut down on the ivermectin. So it's a lower dose and stop mebendazole. So I did. So we're going to see what happens on my next CT scan, which will be my 1-year anniversary of the CT scan in February. And then I'll let you all know what's happening. But right now, this is the best I've felt. But my antibodies went up. So I use ivermectin a lot. I'll give probably a 1-month trial, 0.5 milligram to 1 milligram per kilogram. But I do have pearls about ivermectin. So normally if you see ivermectin come from another country, it'll be like in a 12 milligram pill. And then in the United States, originally it was a 3 milligram pill. So now we have the ability to compound. And so sometimes you want to save pills because it's just so many pills to take. So you might do a higher milligram, like 30 milligrams or 40 or 45 milligrams in a single pill, especially when you're treating cancer, which I do, trying to get up to 1 milligram per kilogram dose, sometimes 1.5. Well, one thing I've observed, and I had it happen to me, if you go up too quickly in the dosage, this is why I would get a small dosage first, 12 to 20 milligrams, and go up every 4 or 5 days, because it can make somebody, and I've had this happen more than once when I have like a 35 milligram or 40 milligram pill, and I'm trying to build them up, and I start with that. Some cognitive issues, some visual disturbances, some balance issues. So that's a thing to look at. And someday I'll talk to you about my experiences with really high dose ivermectin, because it's worthwhile. So I use low dose naltrexone at times, and that's a 1 to 3 month thing, and that's more I use it more for, long haul. Um, but again, tapering it up, 1.5 milligram per week, 3 milligram per week, 4.5 milligram per week at before bedtime. If it disrupts sleep, you go back down in a dose, but try that at least a couple of months if you're going to do it. Nicotine patch I've tried a la Dr. McCullough. It's simple. I like it. I haven't had to use it enough to really see if it helps the cognitive issue. So I'm going to use that a little bit more. And then I'll do a hydroxychloroquine if somebody comes back with a positive ANA. That I think is very reasonable. Now, here's the other thing that I look at as well. Under the base, I look for mold. And all I can say is it's a very controversial area, but it's real. And I got into it because when I was studying Alzheimer's, uh, and I was doing some training. Um, uh, what happened was is that I found out that mold can actually change brain structure size by the work of Dr. Shoemaker. So anyway, SIRS markers, you want to go to survivingmold.com. I put a link in there. Check that out. Then I follow the spike protein. So my favorite kind of tests are, the spike protein antibodies. I'm following those. I do galectin-3 a lot because that's just a more sophisticated CRP, so to speak. I want to bring it down. A vitamin D, keep between 50 and 75, and always a fasting insulin and a hemoglobin A1C. Fasting insulin is my favorite test. If I can keep people close to 5, I don't care whether they're eating a whole food plant-based diet or carnivore diet or modified paleo ketogenic diet, you're going to have a low. I can get your insulin down to 5 or less. That's solid for keeping insulin resistance in check. Um, and then the A1C I like to keep below 5 and the CRP less than 1, ANA negative, red blood cell magnesium above 5, even though the normal range starts lower, and omega-3 fats in the 5s. Now, I've seen people, sometimes the omega-3 fats say, well, more the better. I have seen people when they're in the level of 7 or 8% by weight, and they're not doing as good. So I'm not convinced that more is better for omega-3 fats. Um, Sauna, Dr. McCullough triggered my brain into sweating because as I've come back from colon cancer, I've just had to walk because I've had a hernia from my surgery. And so I can't do the sweating I used to do. And so went back to a Relaxa sauna. It's a home sauna device, but sweating is important. You can't do it by vigorous exercise, which I think is the best. Use sauna and far infrared saunas are good. And I have a link to the sauna that I use. So vigorous exercise is possible. Now, sometimes people say, well, you shouldn't exercise if you have vaccine injury. Here's what I believe. I can just tell you, the patients that exercise in all kinds of illness do better. Now, that doesn't mean you go out and kill yourself and you can't function the next day. So my marker is go out and exercise, build up slowly. I don't care if it's 15 minutes a day, start to 30, but I'm going to have you get up to an hour a day and I'm going to have you do some strength training. But if you're exhausted the next day, then it's too much. And I don't get that often. So if you're exhausted afterwards, that's okay. But if you recover, that's good. And exercisers do better. Lastly is uh, meditation. So I've gotten the work of Dr. Joe Dispenza when I had my cancer, and I can just tell you this, that there's more science behind the study of their approach to meditation or guided imagery. And it's done by UCSD, the University of California, San Diego School of Medicine. I have Dr. Hamel, I've interviewed him twice. They measure everything. You can change. Your thoughts and emotions are energy and frequency. We can't see an MRI, we can't see CT scan, but we know it exists, right? Thoughts and emotions are energy and frequency, and you need to get control of them, not put out quote negative energy and frequency, but positive thoughts and emotions. So for example, I always dreamed of pulling, because I always get to the fax machine before everybody, pulling my CT scans, which I had 10 of them over a year and a half and 4 PET scans, pulling it off there and seeing my tumor gone. And it wasn't just the vision of doing that, it was the emotion that I would have if it was gone. And there are some times where I actually cried by myself in the clinic, just emotion, trying to hold the emotion, not the picture. Now, did I shrink my tumor to nothing? No, I didn't. Am I alive today? Yes, I am. Did I have to do chemotherapy? No. What's interesting is I'm back to the vision that I had myself for being. I had a vision of a certain weight, a certain strength, a certain X, Y, and Z. So do I still have to work at changing my head? Absolutely. I'm still working at it. And that to me is one of the biggest things that you can do. I have sat next to people who have, an engineer cured himself of a brain tumor after massive chemotherapy and radiation therapy. He just said, I'm done, and did the work. So that's an approach. I have links to his work. I know it very well. So lastly, I'd like to conclude with this. I have my normal newsletter underneath this with the links to cancer, to a variety of other things that you can scan through and click on the links. But I look at health. I always say to a patient, your health is like a bicycle tire. When it's running real good, the spokes are tight, great. But you're coming in here with some loose spokes, or you're coming in with some broken spokes or really bent spokes. So no practitioner can tighten or know all, I don't know how many spokes in a bicycle tire, but let's say 30, okay? But the person you go to has an expertise in maybe 5 or 6 or 7 spokes. And here's the truth. You don't have to tighten every single spoke to help somebody improve their health and eventually get well. So what we try and do is whatever we're good at is tighten 5 or 6 spokes, might be with IVs, might be with ivermectin, might be with whatever, and then keep tightening those spokes. And what happens sometimes is when somebody tightens their own spoke, when you tighten 4 or 5 spokes, another 2 or 3 will tighten themselves eventually because the wheel starts turning better and it starts self-tightening. And then if you see a few loose, or you can identify a few more, you tighten a few more. And if you can slowly do that or consistently do that over 3 months, 6 months, maybe even a year with some of these patients, especially when they've been sick a long time and their belief systems are just, down. That's when you can start helping people. You want to tighten the spokes, tighten as many as you can, and then as they keep working on their health and practicing good lifestyle habits, they self-tighten. So I think that's it. I could go into more, but there's a lot in this Substack post, trust me. So my name is Kirk Hamilton. This is the Staying Healthy Today show, and I hope you've learned something. Remember, um, everything's right below. And so I'll talk to you soon, and you have a great day.